Massachusetts Broadcasters Station of the Year. This is Western Mass News at 6 p.m.
Breaking news out of Bay State Medical Center tonight. The hospital reporting a COVID-19 outbreak among employees and patients.
And a 13-year-old receives the ultimate gift from a donor. We hear from his mom and how he's recovering after undergoing a heart transplant. Straight ahead.
Massachusetts and the city of Springfield seeing an uptick in coronavirus cases. Coming up on Western Mass News, how city health officials are doing their part to stop the spread.
Plus, why health experts are warning that a negative COVID-19 test result does not fully stop the spread of the virus.
Now to that breaking news out of Springfield, where a COVID-19 outbreak has been reported at Bay State Medical Center. Thanks for joining us, everyone, on this Tuesday. For Western Mass News at 6, I'm Chris Pisano.
And I'm Jordyn Jagolinzer. Western Mass News reporter Lindsay Kane is live in Springfield with the details. Lindsay?
Chris and Jordan, Bay State officials say 16 employees and 4 patients have been diagnosed with the coronavirus in what's now being called an outbreak at the hospital. In a statement sent to Western Mass News, the president and CEO of Bay State says in part, "We are conducting contact tracing and testing for employees from the unit in question. And we also are reaching out to all patients who receive care on the unit between November 6th through the 16th to provide testing." It's unclear what unit in the hospital is involved, but a report released earlier today says Bay State Medical Center is currently caring for 78 patients with COVID-19. This as the city of Springfield reported an uptick in coronavirus cases this week in city residents. Now, this is a story that Western Mass News will continue to follow. Be sure to stay with us both on air and online for the latest information. Live in Springfield, Lindsay Kane, Western Mass News.
Lindsay, thank you for that live report. And Western Mass News has an exclusive follow-up to a story we first brought you last week, as a 13-year-old from West Springfield is now recovering after getting a heart transplant.
As the local community rallied around him and his family, offering prayers and donations, they have been overwhelmed with the generosity. Western Mass News reporter Sabrina Riley has more.
The doctor called me. He said the surgery is a go. The heart is the perfect match for him.
News that sent the Carlson family into a spiral of mixed emotions, from shock to disbelief, gratitude, and even fear.
I'm very, very nervous for when he wakes up, just because he's been through so much and he has no idea. He went to sleep the first day that we were here, and he's been through the 4 surgeries, numerous machines in his body. Now he's going to wake up with a new heart.
On Sunday afternoon, doctors at Boston Children's Hospital confirmed their 13-year-old son, Devin Jones, was receiving the ultimate gift from an organ donor.
I know, obviously, the reality that somebody obviously had to donate a heart for my child to live. But I totally 100% believe in organ donation. It's a great gift to give somebody. I am extremely grateful to whoever the donor might have been. Because of them, now Devin can live.
This incredible sacrifice came after nearly a month of health problems for Devin, a 3-week hospital stay, 4 open heart surgeries, and the ultimate diagnosis of dilated cardiomyopathy, resulting in a need for a new heart.
We were waiting on the list for 9 days, which is amazing. We don't have any information on the donor, but that could have been one of the reasons why we were so quick, because he was eligible for either an adult or a child heart.
After an 11-hour surgery, the doctors were successful. However, there were a few complications, resulting in the need to leave his chest open to monitor his progress.
There was a tear in one of the vessels that the surgeon had to repair. He also had a lot of bleeding, and a lot of things were inflamed inside his body just because of how many medications he's been on. Even though he had all those complications, the surgeon reassured us that, he was really happy with the result.
Moving forward, doctors say these next few days will be vital for his recovery.
They're very critical days because we need to make sure that his body is accepting the heart.
And although this transplant has been an answer to their prayers, Devin's journey is far from over.
They said it can be anywhere from 2 to 4 weeks post-transplant before he is able to come home. It all depends on how his body heals. After he does leave, though, there is going to be more trips up here he's going to have for the first 2 or 3 months.
Speaking to Western Mass News from her hotel room in Boston, Devin's mom, Sherry Carlson, and sister Ashley want to stress how much the support of the community has meant to their family.
It has just been overwhelming to the both of us. I mean, I want to just say a huge thank you to everybody who has donated, who has even shared. If they couldn't donate, they shared for us to get it out there. Just all the prayers, everything has just been so amazing.
And as their journey to bring Devin home continues, she credits her strength through this process to the community rallying around her.
I have my days where I just cry, and like I said, Sunday was a bad day. But just the support of everyone is really what's making me strong, and I'm trying to, as a mom, you want to stay strong for your kid. So I'm trying to stay strong for Devin.
And if you would like to help the Carlson family through this difficult time, you can find a link to this GoFundMe on our website, westernmassnews.com. For Western Mass News, I'm Sabrina Riley.
Taking a look now at the latest coronavirus numbers here in the state over the past 5 days. The Massachusetts Department of Public Health reporting 2,263 new cases today. That brings the total number of confirmed cases in the Bay State to 186,774. The state also sadly seeing 20 more deaths. The statewide death toll now stands at 10,130.
Tonight, we get a first look at how the city of Springfield is trying to get a handle on its surge in COVID-19 cases with a new public awareness campaign.
Western Mass News reporter Sarah Gurnelli joins us live in Springfield with more on what's about to hit the streets. Sarah?
City leaders are stepping in, coming in to educate community members about new ways of stopping the spread of COVID-19. Western Mass News getting a first-hand look at how local PVTA buses will be used for coronavirus messaging throughout the city of Springfield. It's part of the city's new effort to educate residents on stopping the spread of the coronavirus through a public service announcement.
We are going to have on buses, and we're going to have them in neighborhoods as well.
The signs are both in English and Spanish. Western Mass News spoke with Health and Human Services Commissioner Helen Colton Harris to see when the new PSA will be rolling out.
Currently, the department is in conversation with PVTA. We have the funding. It's just working out the logistical issues with PVTA. So we expect that within the next week, we'll be able to have those messages on buses and perhaps other public transportation.
The city also has ambassadors who are going into neighborhoods to pass out COVID-19 information. She says it's been a team effort with city leaders who've also been mailing out information flyers as well.
We are inserting into a current newsletter that is half in the mail, half went out yesterday and half's going out tomorrow, to about 300 of our active participants to remind them about Thanksgiving and to remind them about congregating in groups.
Colton Harris says the entire city is experiencing the surge with cases in almost every neighborhood.
COVID-19 is ravaging this city and this community, this Commonwealth and this nation. My plea is that individuals will take this seriously and do what we are asking, washing your hands, watching your distance, and making sure that you are wearing a face covering.
And the average COVID-19 positivity rate in the city is 5.3. Statewide, it's just at 3%. So, of course, city officials are trying to do the best they can to slow the spread. Live in Springfield, I'm Sarah Gurnelli for Western Mass News.
Sarah, thank you for that live report. Health officials sounding the alarm about getting a false sense of security during the Thanksgiving holiday.
They say getting a negative COVID-19 test before gathering with family may not fully protect you from spreading the virus. Western Mass News reporter Audrey Russo joins us live with more. Audrey?
The doctor I spoke with says that getting a negative COVID-19 test only shows that you're negative in that moment. He says that if you get it too early, you could be at risk of spreading COVID-19 to your loved ones. COVID-19 testing sites are busy, even on a Tuesday in late morning.
So I think there is an increase in people trying to get the test. I think it started about a week and a half ago.
Dr. Daniel Skeest, an infectious disease doctor at Bay State Medical Center, says he believes many people are hoping to get a negative COVID test before gathering with friends and family for Thanksgiving. And that's a strategy he might have recommended before the cases began spiking.
About a month ago, I might have said, and that was what we were planning to do, was to get tested before we went to a family gathering out of state. But things have changed. The positive test rate is much higher now. We're seeing a lot more people get infected. It's really increasing exponentially.
Skees tells Western Mass News a negative test doesn't completely rule out being sick, particularly because the viral load can take days to build and actually register as positive.
The test, if it's done too early, then it could be negative. And some people can have a false negative test because they get the antigen test, which is not as reliable.
Skees says the only surefire way to avoid spreading COVID-19 is to gather after the pandemic is over.
Because the prevalence is so high here and everywhere else in the country, I think it's better not have any gatherings outside of your immediate family.
The two types of COVID-19 tests are molecular and antigen, the latter less effective in catching an active infection, according to the FDA. Live in Springfield, Audrey Russo for Western Mass News.
Temperatures early this afternoon did actually make it into the middle 40s here throughout the Pioneer Valley. A much cooler day, though, for the hills, some struggling to hit 40 degrees. And 40 is going to be warm compared to what we're going to see tomorrow. Now, the Doppler radar is still a little active, though not as much as over the last few hours. We do still have some spotty rain and snow showers around, maybe a few sprinkles and flurries that could last even into the first part of the overnight tonight. Other than that, just a lot of patchy cloud cover, and we will see those clouds gradually diminish as we head into the overnight hours, so mostly after midnight. 39 degrees right now. Dew points are in the upper 20s. Breezes are still kicking, so it is feeling colder. Right now, wind chills are in the lower 30s. Temperatures are actually there through the hill towns and the Berkshires. That colder air is rushing in on this gusty northwest breeze. We will have breezes stick around through the overnight, so expect these wind chills to continue dropping with temperatures. And we are expecting lows to fall down into eventually the lower to middle 20s, but the actual wind chill will be hitting teens by the time you head out the door in the morning. We'll take a look at your full forecast in just a few minutes.
Janna, thanks. Still to come here on Western Mass News, a local resident showcasing small businesses ahead of the holiday season. And you can browse right from your phone.
Don't want to miss that. Plus, over the border in Connecticut, the CIAC is postponing winter sports. What this means for the rest of the season, straight ahead.